Hannah is our International Nursing Task Force manager, and she's been based in Cambodia for the last couple of months getting the operation slick and the clinic all organised. These 2 weeks will be the busiest of her time because right now we've got the Cambodia vaccination drive currently underway.
I love my job. So I've been working permanently for WVS for about 2.5 years now, but I actually used to volunteer with them on a yearly basis prior to that. Working for a company where the values really align with what I believe in, providing free access to veterinary care is like what I'm really passionate about. You know you're making a difference and you can see that positive difference within the community as well.
The clinic, operated by a team of experienced vets and nurses, encounters a variety of cases every single day.
Our goal is birth control, basically. Birth control meaning like a lot of spay neuter. So that is like the main point. But also we educate people. Like as me, when I come here as an intern, I have a senior who educate me, so I do that.
It's on the side. Tuk-tuk driver, smile. Okay, cool. Message, keep in touch, have a good day.
As the clinic opens, Hannah sends off the veterinary task force team whilst she prepares for the new arrivals for that day. Dogs can be brought in by their owners or they'll be collected by our teams on the road.
សម្រាប់ការដែលទៅរកឆ្កែហ្នឹងគឺសំណក់ដែលពួកយើងត្រូវការសង្គ្រោះមានច្រើនរូបភាពទីមួយពួកយើងរកតាមរយៈការផ្សព្វផ្សាយព័ត៌មានទៅកាន់ប្រជាពលរដ្ឋទូទៅទាំងនៅក្នុងក្រុងភ្នំពេញក៏ដូចជាតាមបណ្ដាខេត្តទូទាំងប្រទេសហើយពួកយើងព្យាយាមទៅរកសំណក់ហ្នឹងនៅតាមសហគមន៍ផ្សេងៗក៏ដូចជានៅតាមវត្តអារាមដែលមានប្រសង់ជាអ្នកទទួលខុសត្រូវលើសំណក់នោះ
But operating on street dogs is never straightforward. This one was brought in for neutering, but came along with a 1-week-old pup who the team have to keep safe during her operation. Once she's examined properly, they also found another problem that needs treating, a tumour called a TVT, which is common in street dogs and spreads through contact.
Right now we are operating, and then after a while we'll give her the anti-cancer drug that we give for TVT cases, and then we'll recheck again next week and then continue checking because those drugs need to be given on a weekly basis until that tumor shrinks down.
So these black spots on the front of her teeth is called tertiary dentin, and that forms when the teeth are worn down gradually over time, and it's when the pulp cavity of the tooth gradually seals over. So when you see dogs with teeth at the front worn down like this, it's often because they're kept in cages and they try to chew their way out.
It's cases like this that underline why we're here and what we can do to help. Without our team present, this girl would have had very limited options. But thankfully, with all the treatment she's getting, she and her pup will soon be okay and back in their communities very soon. And when the paws can't quite reach us or a case requires less surgery, we send the task force team to them.
So the task force team are a team that actually work mainly as outreach. So we have vets kind of all over the world. Basically, we work to go out and collaborate with local universities and local NGOs and run these 2-week sterilisation courses. And we teach them how to sterilise so that they can then continue that work, but in a humane and efficient way.
The task force team consists of a driver, local vet students, and a team leader. And they respond to dogs that are marked for further care by the vaccination teams. Of this group, Chloe is leading, providing her experience to the vets who are essential for translation and local knowledge, as things are vastly different here for Chloe.
The way dogs behave here is totally different. So it's just getting used to like just how to approach them. Because obviously normally they're very, very handled back home, whereas here it's a much more hands-off ownership.
Right? But like, do you notice in this eye how it's less shiny? So the cornea is really dull. And all pigmented, I think. It's hard to say without using a light and a dark room. Can you ask some history, like if it's been itchy and how long it's been like this?
Through translation, we can understand what's happened to each dog. spot problems earlier, and pass that knowledge on to the vet students properly.
So that was a puppy with probably a mite infestation. So we've just applied a treatment that will kill the mites, so that should alleviate the symptoms.
The task force can only do so much with the equipment they carry. When a case needs more care, it's brought back to the clinic for a closer look and proper treatment.
So it's really hard to like diagnose on the spot. So what we do here that they can do there is test. So here would be better to see what is going on, and especially like critical cases.
Back at the clinic, a dog we've been searching for was brought in, matching the description given by the community.
Like the history is kind of went missing for 10 days. I don't know whether it is infectious as well, so I want you guys to be careful. Completely recumbent, a little bit neurological in terms of twitching. Eye discharge. In the video, he was doing that like odd like swimming with his front legs. And obviously all these pressure sores and abscess on the shoulder. So the owner has agreed for surrender for obviously euthanasia on welfare grounds. Okay. Euthanasia is a really difficult conversation to discuss. There's always a lot of challenges as well with discussing euthanasia. Certain religious beliefs means that owners can't make that decision. So the owners feel better if we make the decision as a clinical team to actually do the euthanasia. So instead they often surrender their animals over to us and then we make that decision. When we're doing, oh, sorry baby. You can see here that the dog is really disorientated. The dog does not know what's going on. It's just having a moment.
As the dog starts barking, concerns rise and the mood shifts. This is a dog in distress, and we need to understand why before making any decisions. Hannah calls for a second opinion, because if this dog does have rabies, then this could be serious.
So since this dog's come in, you saw on video actually that sort of disorientated response to like potential noise stimulus or movement. That is one of the characteristic signs of rabies. The next step is not nice. The only way to test for rabies is to take a brainstem sample. So actually what we're going to do this morning is decapitate the dog's head, which is not a nice process at all. It's not nice. I can't do it, but Ganesh is amazing and he will do that for us. It's really important from like a reporting point of view that we test to see whether these dogs are actually positive or not.
In parts of the job it is really difficult, like for say the kind of dogs that we are having right now, when you have to do euthanize the dog, it's kind of very difficult thing to take a call for.
Rabies can only be confirmed after death. So when a dog shows sudden severe neurological signs, there's sometimes no second chance. In this case, the risk was too high. To protect children, the community and everyone working here, the team had to make the hardest decision and put the dog to sleep. The results came back negative for rabies. That means the virus wasn't present and the community is safe. It doesn't change the outcome for that poor dog, but it does help protect many others. And this is why we do it. Why we make the hardest calls, why we show up, even when it hurts. To protect people, protect animals, and prevent suffering wherever we can.
When I come out as WVS, I'm so proud of what we do. I'm proud of everybody that I work with, and yeah, I'm really, really proud to be a part of that.
Thank you for watching the video. You can always get involved with our work by clicking on the link in the description. Whether you're an aspiring vet or a passionate animal lover, come and get involved. And as always, rock on.
Do you mind telling me today is as well?
It's my birthday. Today is my birthday.
How old are you, Abby?
21 again.